Okay. All right. Well, thank you for joining us this evening. For those people who haven't had a chance to meet me yet, my name is Dr. Janine Hubbard. I'm a registered psychologist here in the province, and I work pretty exclusively with kids and teenagers and young adults. And I do a lot of work around medical interventions. So things like needle fears and phobias right up my alley. And I'm delighted that we've had this opportunity on behalf of APNL to provide a public education session. I'd like to very briefly introduce my two other APNL members. Darryl Murphy is our central rep and an educational psychologist with the school board, and he's going to say lots more about himself in a couple of minutes. And Sally Payne, we're very excited. She's doing all of our technical assistance, and she is our fantastic grad student rep and is one of the PsyD students at MUN. So she's working on her doctorate in clinical psychology and is a powerhouse. And we can't wait to welcome her as a colleague in a couple of years. So thank you to my colleagues for their assistance this evening. This is always with a webinar, feels really weird and artificial to be talking to my screen without a whole lot of audience feedback. So we certainly are asking any questions at all. Please type them in the chat, and we'd love to have kind of an open discussion. And otherwise, what I wanted to do was just start the evening by just talking generally about some coping tips for kids and needles. And this isn't just kids with severe phobias or fears. This is just, actually, it's good advice, hopefully, for any of us, but particularly when we're working with kids and vaccines. Step number one is to know your child's coping style. While there's lots of variability in it, we know that kids often go to one of two extremes. It's the tell me every single detail about what's going to be involved. I want to know step by step what to expect. I want you to tell me before each step happens, like they really want to be in control, feel prepared during the actual activity, really, feel in control of the situation. And then we have the tell me when it's done. Keep me distracted and just get it over and done with. I don't want to look at it. Just like count to 3 and just get it over and done with, kids. Obviously, there is some middle ground, but for the most part, we do tend to see that kids kind of fall in those extremes. So really knowing that coping style is going to help you figure out how do I want to prepare my child. So certainly, if you are the, I want to know every step, I want to know every detail, if you have one of those kids, this is great. The more information you can give them, the better. As always with all kids, really helpful to start with the, well, what do you understand about what's happening? What do you know? And let your language help them to kind of anticipate those next steps. How you approach the topic is incredibly vital. Kids are going to pick up on if it's something that you've had really negative comments about, or like, oh, those needles, or, it's something that you're really fearful of yourself, they're going to pick up on it. At the same time, really important to be truthful. Nothing worse than saying, oh, don't worry, it's not going to hurt at all. Well, the reality is needles aren't pleasant. They are very briefly uncomfortable. And so that piece is going to be important to give really age-appropriate, truthful language about what to expect when it does happen. And again, hopefully it's something you've gone through yourself recently so that you're able to kind of walk them through some of those steps. And Darryl's going to help us to understand what the process might look like in the school system. But again, helping to prepare. If you have a kid who's really anxious, maybe you need to take them to the location where the vaccines are being administered so they can look at it ahead of time and have an idea of what it visually is going to look like. Otherwise, even doing things like looking at videos online of kids getting vaccinations, watching that process. For some kids, rehearsing it with them. So, getting some alcohol wipes, practicing that effect with them so they get used to the sensation, they get used to the smell. Again, focusing on the things that are within their control. We know that it's preferable to have a short-sleeved or even like a sleeveless outfit, top with maybe a cardigan on top. Let them pick out from their wardrobe what piece of clothing are they going to feel comfortable in, what's going to work for them. And then, like I say, walk them through step by step what to expect. Big step. The kids who are the just tell me when it's done. Those are the kids where we're going to, in some cases, if they've got really high anticipatory anxiety, tell them the morning of or the night of, not 2 weeks ahead of time. Here's when your appointment is, if that's something that's going to cause them a lot of distress. And then otherwise, really, I mean, there's no magical trick, but it is a combination of preparing ahead of time your coping strategies, which usually fall in a combination of distraction, like active distraction, some muscle relaxation, and if need be, a little bit of work on their breathing. Those are the pieces that are going to really help get your kid through the process. And again, some kids rely far more on the, let me relax my muscles, let me work on my breathing. For especially really little kids, they often have trouble with the concept of taking a big breath, like that deep breathing. There's some games we can play, and I can teach you a couple of them tonight, but really there, it's far more focusing on the distraction piece of things. So figure out for your child, what is the best way to keep them distracted? Is it just talking to them? Is it bringing a stuffed toy? Is it, you know what, this is one of these times, pull out the iPad, pull out the phone. If it helps to let them watch a video or a show or listen to some music or play a game, anything along those lines that's going to help with active distraction, it's great. But it's not something that you want to be figuring out on the fly while you're in line to go in and get your vaccination. It's something that you want to have practice with them and plan for ahead of time so that you have some ideas as to what kind of distraction technique works best for them. Again, some it's the, I just want to listen to music and tune out the world and don't have anybody talk to me. Others, it's the engage me in conversation. Talk to me about this piece of things. So the more of that piece you can do in advance, really, really helpful. And then at the actual activity, working on, before the actual activity, I apologize, working on, I always call it spaghetti arm, because one of the things that we know is with needles, the tendency is to clench up and tighten up everything. And that actually makes it far worse of a process. The more relaxed the muscle is, the more loose that arm is, the easier it is for the injection and the quicker and less painful it's going to be. So getting your kids to practice, in some cases it's doing a shoulder shrug and then relaxing. In some cases, I like to, talk about spaghetti arm or noodle arm, or, some of the little boys like the idea of like it's worm, some of the girls too, but, whatever imagery you can help them come up with to relax those shoulder muscles. As I alluded to earlier, really little kids don't tend to do very well with the, we'll take a big breath. Some of them do great with it. Some we like to use some activities. So whether it's the, okay, I want you to pretend you're blowing out the candles on a birthday cake. And again, use that imagery, get them to imagine what the cake looks like, what the flavor is, what the toppings are, all of those things to help distract, and then take that big breath. I'm a huge fan of when in doubt, if you've got a tissue handy, you can play a contest with them, which is also fun because it gets in the competitive streak. But it's the how long can they blow on the tissue? It's visual, it gives them reinforcement, it gives them an idea of how they can manage it. So it's far more better feedback to them in terms of, because oftentimes they'll start on the or something like that. So you can then help work with them on, well, this is what a deep breath looks like. Probably my all-time favorite breathing activity, just because it's fun and it's silly and everybody seems to enjoy it no matter what their age. If you got a water bottle or just a glass with a straw of some sort, let them take a giant breath and blow bubbles into that beverage as hard as they can. Again, you can turn it into a game, time them, get them to do it once and time them, and then let's see, can you beat that score? Or again, for the kids who like being competitive, you can do that with them as they're gearing up. So great way, both it's active distraction, it helps with the breathing and the physical relaxation. And you know what? It's silly and fun and gives you a chance to be a little bit goofy, which when you're feeling anxious, that's always a really helpful strategy to use. The other thing I wanted to mention in terms of preparation, most kids do just fine. They go in, they go out, it's really easy. Some kids like the use of a numbing cream. For something like a vaccination, it's often not necessary. It's far more helpful if you've got like an IV insertion or something. But some kids, it provides them that extra level of reassurance because it's just a topical anesthetic. You can pick them up at any drugstore. EMLA is one of the common brand names that is used. And what I suggest is if you think that that's something that would be helpful to your child, practice with it beforehand. For any of these things, don't just spring it on them the day of the vaccination. Practice, let them have some control. So do a sample, have them do it either on their shoulder or on the top of their hand ahead of time, and then kind of feel, well, what does it feel like to have that little bit of my skin numb? For those not familiar, the way it typically works, we put a little bit of cream on, and then basically almost put some cling wrap or saran wrap, or there's proper fancy bandages that you put on just to protect it so it doesn't rub off on things. Put it on about a half hour before you need the area to be numb. And then again, you can arrive at the vaccination site with it on. Generally lasts, like I say, about an hour or so. So you kind of want to time your things there. But you can come on, and again, deciding on how much control your child wants, either you can take it off and just wipe off the cream. You can have them do it. The public health nurse who's doing the vaccination can do it. Whatever, again, works and is comfortable for your child. But a lot of kids do find that just adds that extra little level of confidence, and it's quite inexpensive. So it's a strategy that, again, a lot of people may find helpful. On that note, I'm going to pause for a little bit and throw things over to my lovely colleague, Darryl Murphy, because one of the unique decisions that we're able to do for our kids this time around is decide, again, going back to knowing your child, where is the best environment for them to get their vaccination? For some kids, it's absolutely with you at a vaccination clinic. For a lot of kids who are already used to getting their needles at school, who are already used to the peer support and that environment, the school is the best possible place for them to be doing their vaccination in terms of anxiety and comfort. So we've asked Darryl to talk a little bit about what the process is going to look like in the schools, partly so you can share that information with your child, though again, the schools have been doing a lot of that, but also so that you can make an informed decision as a parent, what is the best choice for your child. Darryl, I'll let you take it away.
Thank you, Dr. Hubbard. So as we mentioned before in the beginning there, I'm Darryl Murphy. I'm one of the psychologists that work in the school board office. We have 40 psychologists throughout the province, including Labrador as well, working in schools. But the reason I came today was I had a little bit of experience when we went through H1N1, and I've seen some of the schools already now roll out the present vaccination. So just to kind of give you an idea around how that works. So generally, on all cases, you're going to get a copy of a consent form sent home to you. It's a fairly short turnaround time. So check those book bags and make sure that that's in there and filled out and sent back. You'll get memos and notifications from the school, from sometimes through their Cinevoice or social media around when the session will be. The Department of Health will decide when the sessions will be for each school, and they'll arrange for the day. You'll get notified when that day is. There's a fairly good chance you'll get notified the specific time or time frame in which your child's class or grade will get their vaccines. The school board and the Department of Health have sent out some information to schools to help prepare children for this process, as well as some of my colleagues have also prepared some information for schools to help prepare our children for this. So, and as mentioned, as Dr. Hubbard mentioned, we have done vaccinations in schools before. Grade 4s get their school needles for various things, vaccines, and up through. So K to 3 will be the newer group to expose to the vaccine process this time. But I went to one of the schools, a nice big K to 3 school on Friday, and basically this is how it rolled out for them. They lined up by class to go up to the vaccination area, which was either the music room or the gym or one large area. So they'd line up outside, and some students would go in right away, and others would be waiting there in case their parents are coming during that time, and there'll be someone at the door to try and collect the parents and bring them to their child. Parents can come to the session with their child. They'll have to wear a mask, but they won't need to show a Vax Pass for this specific event, and that they'll go into the vaccination with their child just into the actual vaccination. They won't go through the school or other areas of the school. So the children are lined up. They go in one by one. So I'm going to admit someone else in there. They're going to go in groups, in small groups. They'll sit down possibly in a little waiting area that's there. The school that I was in, the waiting area had some films and videos and movies on in the area, so the children could be distracted. They were led over to the area. The nurse had a quick conversation with them, and before they knew it, vaccination shot was done. Then one of the other staff would keep track of what time the students got their vaccinations, and like a 15-minute timer. They'd stay in the waiting area for that time, and we'd bring them back to class. I was at a school, again, on Friday. It's a pretty large school, 400 plus students, and they had gotten through more than half the school in a couple of hours. It was a well-oiled machine. The students are well used to lining up and going through the school with their teacher, waiting, and then turning around and coming back. So, and for the most part, the students are just kind of chatting with each other and encouraging each other in the lines and having nervous conversations. But for the most part, they were proud to show their Band-Aids and tell me all about the fact that it felt more like a mosquito bite or a poke in their arm, and they weren't as worried for the next vaccination needle. So that was really good. We do suggest to the students that they have a nice breakfast that morning and wear a short sleeve shirt. It makes it way easier to do it on that day. The schools and the Department of Education and the Department of Health have also noted that your child's eligible for the vaccination shot in their school, but they wouldn't be able to kind of go to another school if they missed that time. And if they do miss their time in the school on the day it is, they'll have to make their own arrangements with the health departments around to get their vaccination shot. We don't have any information yet as to when or how the next vaccination, the second shot, will go for our K-6 students. So we're going to let people know about that when we get the information on it. And other than that, I will leave it back to Dr. Hubbard. And if there's any questions in the chat box or otherwise, I'll respond to those shortly.
Okay, thank you, Darryl. Much appreciated. And again, happy to open this up for discussion in chat. If you have any questions, please, we're encouraging you to just put them into the chat box. If you're having any real difficulty, you can let us know on that. One of the questions that was raised to me before this presentation is a really, really excellent one, is what if my child doesn't cope well with the initial vaccine, and now I know that I have to get them for a part two, which again, no question, it can be a challenge. It's interesting because in most cases, one of the reasons that people are so fearful of needles, I mean, like I say, it's not a pleasant experience, but because it's something that we encounter so infrequently, most of us, it's maybe once a year at most. And what we have a tendency to do is in our minds, the longer an interval goes between an unpleasant experience and having to do it again, in our minds, we build it up as being a much bigger, much worse event than it actually was. You're somebody who has to get needles a couple of times a day, or even, that needs to do something on a more regular basis. You very quickly, your brain reminds you, yeah, it's not great, but it is over quickly and it's not that big a deal. So for a lot of our kids, it's actually, I think in many cases been worse for our adults because many of them have gone a much longer time between needles. Our kids have been getting a lot of their school vaccinations and their flu shots. So it is perhaps more familiar to them, which hopefully is one of the reasons why this time around, actually, our kids have been having a really positive experience. I've been hearing great reports. They're excited, they're proud. And in some cases, because they're the last, other than our really little kids, to have this happen. They've seen their parents do it. They've seen their big brothers and sisters do it, and they've been feeling like they're missing out, or there are things that they're aware that their family can't do because they haven't yet had their vaccination. So that has certainly helped with the motivation. I've never in my life had so many kids almost excited, and in some cases legitimately excited to get the needle and really proud of it. However, there may be some cases where it doesn't go so well the first time around. And then the kids know they have roughly, I'm assuming it's going to be a month, but again, we'll know some of the details before they have to do it again. And then it is more time sensitive, and that can start to build up the anxiety in some of those kids. So that's a group that we really want to make sure we're targeting, if that's going to be the case. So one of the best things you can do, especially if you've got a slightly older child, is problem solve with them. Partly you'll be able to kind of have a sense as to what went right, what went wrong, where were some of the challenges, how would I do it differently, but get their perspective. What was it that triggered them? What was it that got them really upset? Was it a sound they heard? Was it a smell they heard? Was it, seeing some of the materials on the table? Really break it down step by step in terms of what was it that initially got them upset? What did they find difficult? What did they find not so difficult? What were the parts that they were able to manage? And then really from there, that's where we want to break it down and problem solve okay, so that happened last time. So what do we need to do differently this time? And again, the more control you can give a kid who's anxious, the better. So help them give that input into what, I really didn't like seeing the needle on the table, or I didn't like the line, or there were noises, whatever it is. Help them figure it out. And then again, certainly, the school's going to be very supportive. And if you find it easier to go into one of the clinics, I have a number of my parents who've been making a point of, either talking to the clinic ahead of time, or in some cases, leaving your child and another parent or an adult in the car, going in, sussing out the situation. Sometimes it's explaining it to the child. Sometimes it's just giving the staff a heads up and saying, look, I've got a kid who's really, really nervous. Here's what they find helpful. The other thing that I didn't mention in our initial discussion is some kids find it incredibly helpful to have some variation, they have different names, of a coping card. So basically, it's if they're feeling really anxious, hand your healthcare professional a coping card that says, these are my coping strategies. Please ask me about my dog, Lola. Please, warn me before you're doing this. So that, again, you've written out for them, here are my coping strategies, here are my fears, so that you don't even have to have that conversation with the healthcare professional. You can just hand it to them. And that immediately gives them the tools to go, okay, right, I know how to handle this kid. And without having to explain it in front of them, without having to drag out the process. Again, if you look online, there's tons of different versions of them and templates that you can find. But the reality is it can be a sticky note. It doesn't have to be anything fancy or complicated. Okay, I'm wondering, Sally, can you let us know if there are any questions or discussion, or because we are a very small group here tonight, like I say, this will be posted for the general public. So I, understand if people want to remain private, but if there are some questions, we would be more than happy to answer them.
As far as I can see, there's nothing in the chat. So I think it's
okay. Well, I will give people just a quick opportunity. If there's any burning questions, please let us know. And otherwise, we'll give it another minute or two. Okay, here we go. I'll let Sally, can you field that? Let's see. We've got a question that has come up. Oh. Or do you want me to pull it up? I can pull it up.
I'm sorry, I'm in the chat. I can't see anything other than what I posted.
Okay, because it came through as a direct message to me. So hang on a second.
Oh,
I saw it, but then it has vanished on me. I apologize, bear with me. Okay, we have the question. What would you recommend if a child gets to the appointment and absolutely refuses to get the shot? Oh, I'm sorry to hear. Okay, my daughter recently had a total meltdown over an alert test, and we left without doing it. Okay. again, it's, that is a tricky situation and certainly one that we know. Okay, that makes sense. I was wondering what the test was, an allergy test. Yes. Okay. Again, a couple of things. I'll be honest. The allergy testing, way more intrusive, way more unpleasant, way lengthier than the vaccination process. So in her case, I would certainly recommend talking her through what to expect and how different it is. Again, getting her to talk about what got her upset, what stage of the game did things start to escalate, when did they start to kind of go off track. For some kids, depending on their age, I will sometimes even do I'll mimic the process of, oh, okay, let me double check. Your name is so-and-so, your MCP is this. That's great. Okay, I'm going to do the alcohol wipe. All right, when you're ready, I'm going to do 3, 2, 1, done. Get them with either a stopwatch like on your phone or with them count how many seconds that process takes. I guarantee it's less than 30. And in fact, the actual between the wiping it down and done, maybe about 5 seconds. And so again, that's a way that gives them some control to say, this is literally how long it's going to take. I can keep reminding myself of that. That's a coping tool that I have. And yeah, in her case, I am really sorry about that. But like I say, there I would find out or try to problem solve what were the triggers, what piece set her off, at what point in the process. Was it the anticipatory anxiety before even getting there? Was it in the car on the way there? Was it arriving in the parking lot? Was it going into the building? Like really break things down step by step, either following your own intuition or, like I say, your child's feedback to try to figure out where things broke down. I hope, does that make sense?
That's great. Thank you very much, Dr.
Oh,
Hubbard.
you're very welcome. I'm sorry you went through that. That being said, I was going to say, I remember as a teenager, it's one of the few tests I got woozy at. They just the allergy testing, and the irony is they made me lie down and then I had to go back and do it again because the results weren't valid because I had to lie down. So it wasn't all, yeah. Like I say, the vaccine itself hopefully should be much smoother. And again, if you need to, go find some of the videos online. For anybody who doesn't yet or isn't on social media or doesn't follow us, at APNL on Twitter and Facebook, not a personal plug, but I post a lot of psychology stuff at Hubbard Janine. I've been posting all kinds of kids and vaccine links in the last month or so. We are so blessed in this country. I have to give a shout out to some amazing colleagues of mine. Dr. Christine Chambers is at Dalhousie and started the It Doesn't Have to Hurt campaign and program, and they've got a phenomenal website if you want to check it out. But we have a number of psychologists, Melanie Noel, Katie Byrne, have been doing some groundbreaking research about kids and pain in this country, and they've all been offering webinars. They've all been offering videos. Like I say, the It Doesn't Have to Hurt has some great videos of kids demonstrating, I don't like this, but I'm coping with it. Or, I mean, there's a sweet one that talks about language to use versus language that's more likely to trigger. So take a look at some of these. Anxiety Canada, again, is a fantastic website. Has all kinds of great resources about all things anxiety for kids, for adults, for teens, you name it. We actually are incredibly lucky in this country, the wealth of really talented people we have addressing both needles and pain and anxiety in kids. So there's no shortage of resources. Please reach out. And like I say, a lot of that stuff I've been posting on social media. And if you're running into trouble accessing it, just reach out to me directly. I'm not hard to find. Any other questions? Any other things people are wondering about? Or anything from my two fellow APNL members that they'd like to contribute or comment?
Yes, I was going to say, Dr. Hubbard, I mean, I saw literally hundreds of children go through in that short period of time and they were all super proud. They were showing their Band-Aids. And I had 4 or 5 of them telling me about the trips that they got planned, and they were going to get this treat when they got home. And it was a whole plan that they had, and they had worked out obviously with somebody. So that was really nice to see. And for the most part, they're all on the line. They're just kind of nervously chatting, and they're not there very long, but they're all kind of egging each other on, like, we're going to get any, we're going to get any. And then it was a really positive kind of experience. Very positive. I was very pleased to see that. And that seems to be the general information I'm getting from a bunch of the schools. That it's quick. They're going through most of the students really quickly, amazingly quickly, and the students are finding a very positive experience, which makes it better for us, of course, next time, because one positive experience leads to another positive experience the next time.
Absolutely. Thank you, Darryl. And again, really good comment. It reminds me a lot for those of us in healthcare. We were, some of the earlier participants with that first vaccine. And let me tell you, actually, even when I went back for my follow-up, the chatter in the waiting room and the excitement and yes, this is a good thing. Now, if you're someone that's going to really distress, again, get your kids wearing the headphones or doing something to help block that out. But for a lot of people, that mutual support is incredibly helpful. Another question I was asked earlier today, is it okay to promise your kid a treat at the end of the day? You better believe it. I don't know about you guys. I treated myself to some sushi takeout after my first one. This is something that, either it's because you're celebrating, because this is an exciting, hopefully next step towards trying to return life to as much of normal as we can. But also we're acknowledging to our kids, hey, you did something hard. You did something, you were brave, and yeah, absolutely plan a treat. It's not bribery. It's acknowledgement of a job well done. And there's nothing wrong with that. And honestly, I think in some of these cases, knowing how stressed some of the parents have been, I think the parents deserve the treat as much as the kids do. Because again, there's been, a lot of effort and a lot of work gone in on the home front to get the kids ready for this. So celebrate and reward yourself as well. And on that note, not seeing any other questions or comments, I'm going to close this down for the evening. I'm going to stop the recording shortly. And I do want to say thank you to everyone who joined us in person. And for anyone accessing this on our website later, I hope there are some useful techniques. Please, remember that this is something that is manageable. This is something that's doable. And there are an awful lot of techniques and tricks out there. It's a question of personalizing them and finding what's going to work best for your individual child. So on behalf of APNL, thank you so much for joining us.